So a client asked us this week about how to address privacy and using the name of an employee who tested positive for COVID-19. As an employer, you would not use the employee's name. You want to respect the employee's confidentiality and ensure that the employee understands that they will not be identified by name to their coworkers and team members. There are some cases where on a need-to-know basis, an employee, and with their permission, it may go to someone. So for example, on a need-to-know basis, I might find out that one of our managers has tested positive, but that would only be as a need-to-know and it would not be shared in any way. So for contact tracing, as an employer, you're required to take steps to investigate who else could have been affected or infected by the employee. So it's important, obviously, for contact tracing that the HR professional or someone knows who, the person who's responsible for health and safety would know who had contact with that person. But you would simply say, someone who tested positive was in the office on this date when you were also in the office, and you may have been exposed to it. Please go home and self-isolate, seek guidance from public health, and get tested if it's recommended that you do so. Now, at one point, employers were sometimes sharing the name of the individual who had contracted the virus because they felt that because it was an infectious disease and it was so incredibly viral that it was important that people know who it was. But that certainly has been since then not common practice, and because privacy is legislated, medical information would not be released by name.